so you stay safe and healthy, right?
Yes. Hope you're doing too.
And of course, I'm sure that you must have been practicing social distancing and working from home as well.
Absolutely. We have divided the embassy into a couple of shifts, and we try to work as much as possible from home, and then not more than every second day I come to the office, and sometimes more seldom.
Ambassador, I just introduced that Sweden still hasn't introduced any lockdown at all. Is that true?
Although there's no full lockdown in force in Sweden, many parts of the Swedish society have shut down. I mean, I talk to my two daughters very often, and they have been working from home for several weeks, and I think that's something we see quite often. But the Swedish measures differ from some other countries fundamentally in two regards. First, because we are not shutting down schools for younger children or children's care facilities. And secondly, we have no regulation that forces citizens to remain in their homes. But this is based on a tradition of using recommendations in public health efforts that we have followed for a long time in Sweden. And we have seen that it works, for instance, in vaccinations, and that's to a large extent because there's a high level of trust in the Swedish society. But basically, we are facing the same challenges as many other countries. We share the same goal as all other countries to save lives and protect public health. And we are using similar tools as most countries, promoting social distancing, protecting vulnerable people, carrying out testing, and reinforcing our health system so that we can cope with the pandemic.
So in short, Sweden is not enforcing mandatory rules so far, right? In short,
there are several mandatory rules. For instance, there is a total ban of visit to elderly care homes. There is a ban of meetings with more than 50 people. But the major difference that I mentioned is we have no regulation that forces citizens to remain in their homes. And we are not shutting down schools for children up to 15 years. And there are a couple of reasons for this. I mean, if you have a very drastic and legally binding lockdown everywhere, it is quite difficult to do that long term, and we see that kind of discussion already now taking off in several countries. And secondly, the decisions taken by our government are based on advice from our expert agencies. And when it comes to school closure, they haven't recommended school closures for these younger children, partly because almost 40% of all healthcare staff would have to leave work if schools were to close. And we need those healthcare workers, and we need then to create conditions for them to be able to serve the people that are ill.
No, but it looks like not everyone agrees with this approach. A group of doctors, as you know, have written an op-ed piece and published in some newspapers in Sweden, calling for stringent measures to deal with the situation.
Yes, and there's I listened yesterday to the response from the state epidemiologist Anders Tegnell, and there are, I think, now 3 other op-eds in that newspaper which are criticizing the other researchers. I would say that this is, I think we all benefit from a transparent, free and open debate about these and other matters. These are no simple things, and it's far too early to say what has worked and what is right. The government is basing its decisions on advice from the expert agencies. And I think the major advice that I mentioned is to keep social distancing, to make sure that we protect particularly elderly people, vulnerable people, but so far not closing schools for younger children, because that would probably create more problems than it would solve problems.
Ambassador, sorry to interrupt. Can you adjust the camera just a little bit because we cannot see your face fully? Okay,
Is this better?
This is perfect. Thank you very much. Ambassador, is Sweden under pressure from surrounding countries, from your neighbors like Norway, Finland, and Denmark, because these are the countries that have announced lockdown already?
We can definitely learn from each other, and we do that all the time. We have an excellent cooperation between the Nordic countries and between the European Union countries. Our government ministers are in close personal contact with their Nordic counterparts and their European Union counterparts to cooperate and to share experience. I haven't seen any kind of signs of pressure. Obviously, as I said, there's a debate ongoing in Sweden and also on the global arena, and we can't be sure. We don't have the end results of what has worked and what has not. But I think it's the major lesson when we look at the relation between countries is that while every country, of course, individually must do what it can, the virus doesn't know any borders. International cooperation and solidarity is more important than ever. We need the United Nations. We need certainly a well-funded World Health Organization. We need the European Union. We need ASEAN. I'm very happy to note Thailand's recent initiative there. Countries must continue to work together within these global and regional structures to mitigate the spread, to safeguard the maintenance of democratic principle, and to protect human rights also in these days of COVID-19.
Mr. Ambassador, as far as I learned from media reports from Sweden, it looks like the majority of the people are complying with the directives on social distancing. Is that the case?
Yes, there are several indicators of that. You can see the drastic reduction of domestic travel, for instance. You can also see that the spread of the seasonal flu, which normally is quite widespread at these times, it has gone down to very low levels, and that's an indicator that the social distancing is really taking place.
And overall, how do you evaluate the situation in Sweden? Because right now, the total death is about 1,200. Do you think, have you reached the peak of the pandemic already in the country?
Well, I'm not an expert in this, and I think the experts still are quite cautious to talk about reaching the peak. I think what I hear them saying is that we have problems in the elderly care homes, which we need to address. We have seen that in Stockholm, and we need to try to protect the rest of the country. We've also seen that the health care system hasn't been overwhelmed. It's stretched, but it hasn't been overwhelmed. I think that's one good sign, because when we've tried to flatten the curve of infections, then one major objective there has been to make sure that our hospitals and our health workers, our intensive care is able to cope with the infections that come in.
And what
Mr. Ambassador, on the website of your embassy in Bangkok, you still have the announcement discouraging people from making non-essential travel to Sweden, meaning that if you apply for a visa in Bangkok, it's likely that you will get rejected. That's still the case, right?
Yes, I mean, for the moment, basically the Swedish borders are closed for visitors. There are exceptions related to people from European Union and having their homes in Sweden, such examples. But for the moment, we have those kind of restrictions, basically following what the European Union recommended I think it was in early March. In the other direction, we have a travel advice against all non-essential travel by Swedes to any other country in the world.
So that means that we should not waste our time trying to apply for visa at the embassy at this moment if you don't have any important matters.
Not the right time.
And overall, should I say that Swedes feel like normal days, or do you think daily life have been disrupted quite a bit in Sweden?
Yeah, life has been dramatically changed in Sweden as in so many other countries. And first of all, of course, with the human cost. I mean, in these days, people all over the world suffer the loss of relatives and friends, loved ones. And that happens in Sweden as well. And we all suffer from those tragic human consequences of the pandemic. But then, as I said before, social distancing is really taking place, and we have seen significant changes in lifestyle. People are working at home, and there's an economic price that we are paying for this, as many other countries, but it's necessary for the moment. What hasn't been seen as a good idea is to close down schools for younger children. It's possible to do it. The government has the legal opportunities to do it, but so far we have believed that isn't the right way to go. And strong recommendations, as you said, they are followed if there is a high level of trust in society.
And how do you see the way Thailand is handling the situation here?
Well, I mean, I think we are lucky that the level of the healthcare system in Thailand is so high. I mean, we know that Thailand has great doctors, great nurses, great hospitals, and I think that's really something that Thailand should be proud of. We see here measures taken that are necessary, and I mean, I would definitely advise all Swedes to listen to and respect the advice and regulations issued by Thai authorities, and that they should keep themselves informed on the latest developments. Secondly, I would like to also say to Swedes in Thailand, if they want to return to Sweden, I mean, some don't, but those who want to return to Sweden, make use of the remaining opportunities. There are a few remaining commercial flights, in addition to the recently assisted flights arranged in close cooperation with European partners. So use those opportunities, and then also to follow the embassy on Facebook, our app, our website. We will do what we can to give Swedes the best possible information and guidance. This is a difficult circumstances. All governments, Thai government and the Swedish government, are struggling with an unprecedented challenge. But we need to face this together, and I think with a very close people-to-people relations that we have between Thais and Swedes, I think we'll get through this together and we'll come out stronger together.